everything to do with fertility, preconception, conception, pregnancy, postpartum. You've always been my go-to. In this episode, let's talk about miscarriage and all the do's and don'ts.
This is nature's way of ensuring that only the healthiest babies are born.
Everybody who goes through it just deals with it in so many different ways. It could be fear, shame. Out of 100 pregnancies, 50 of them turn out to be miscarriage.
Those numbers itself should tell you that you're not alone. There is no need for shame. There is no need for guilt.
With IVF and IUI now, are there higher numbers?
IVF does have a lower live birth success rate, means 1 in 3. If you have a miscarriage and it's the first miscarriage, many times it's the best window to conceive again within 3 months. If it's a second miscarriage, you should...
For years now, everything to do with fertility, preconception, conception, pregnancy, postpartum, you've always been my go-to. But in this episode, right, I think I wanted to really talk about one subject which is not spoken about by anybody or anywhere, which is like miscarriage, right? I think the reason also why I've never fortunately had to go through it or anything, but then I've realized that everybody who goes through it just deals with it in so many different ways. And a lot of it could be fear, some shame, some, like just uncertainty of, oh my God, what next? And in the last 3 months, I've actually had spoken to over 6 women who came to me and said, what is the next step after we have a miscarriage? And this, I'm talking about women from 25 to like 36, 37, and women with natural conception, IVF, IUI. Honestly, I don't have an answer for any of them, except that rest it out, talk to your gynac, and if you feel good, you'll come back and start movement again. But then I said, okay, you know what? I think this is a topic we need to address, and let's put in, a 20, 30 minute episode. And who best to talk about it than Dr. Mahesh himself? So yes, let's talk about miscarriage and all the do's and don'ts after. Yes, we can touch upon why maybe a little bit. But I remember in the PDF you shared, you mentioned out of 100 pregnancies, like 50 of them turn out to be miscarriage. Is that the numbers?
Absolutely. Those numbers itself should tell you that you're not alone, right? Yes. So this is data from the Stanford Medicine University, and they have an interdisciplinary committee on repeated pregnancy losses. And one of the key things that they want people to know is that out of every 100 pregnancies that are confirmed by a pregnancy test, right? So you do it at home, then you do a blood test, your doctor confirms with a particular blood test called beta-HCG. And out of 100 people who get a positive beta-HCG, only 42 of them go on to have a live baby. So literally close to 58% of human pregnancies do not result in a live birth. Now, why would this happen? The best guess that we have from a science point of view till now is that this is nature's way of ensuring that only the healthiest babies are born. Nature wants to make sure that if there is a defect in the fetus or it's going to harm the mother in some way, and there shouldn't be a lifelong burden on either of these people. And therefore, only after checks and balances are all clear, that's when the pregnancy actually proceeds. So the first thing you need to know is most people don't tell anybody else about miscarriage. So we end up thinking that it's only happened to us. Even in close family circles, we all know in India, for example, the first 12 weeks, we don't tell anybody except parents. So you have to wait for 12 weeks to go before you're sure. And we always knew from ancient wisdom that the first 12 weeks belong to Mother Nature. If she's going to allow the pregnancy to proceed, then it's likely a healthy pregnancy. But if she's going to terminate it sooner, you'll have to accept that this was probably for the best. It doesn't mean we can't do anything about it for the next time, but at least this time you should know there is no need for shame. There is no need for guilt. And again, another thing, like you said, there are times when people will come to me and say, I knew I shouldn't have taken that auto ride. It's terrible. It's a bumpy road. And that auto rickshaw, I have to tell them that God has not created us to die so easily. an embryo is stuck to the uterus so well that unless you do something extreme like bungee jumping or jumping up and down on a trampoline or something, you simply cannot dislodge a baby or lose it to miscarriage. So, the first thing one must know is miscarriage is extremely common. It is not spoken about, so a lot of us carry stigma. But you should know that this is nature's way of probably telling you that you need to be more prepared. The baby needs to be of better quality. So take it in that spirit would be the healthiest way of looking at it.
So, before we go into talking about the top 5 to 6 things to do after a miscarriage, just very briefly, why does a miscarriage happen from a female or a male health point of view? Because this, again, a lot of the times we always say, oh, the woman couldn't carry the baby and something of that sort, right? So, very briefly, Doc, what could be like the top 1 or 2 reasons why this happens?
So I would say there are two big reasons. One is either poor egg quality, which means indeed the woman needs to nourish herself better before she has a next pregnancy. But the second one is very easily forgotten, which is that the man's sperm could have had a problem as well. Sperm that otherwise looks healthy, which means it has the right count, motility, shape, etc., is not tested in this country for something called DNA fragmentation index, which basically measures sperm that otherwise looks healthy could have DNA damage. And if that happens many times, you could have a positive pregnancy test, but at the 6th week, there's no heartbeat that develops. Or in the 8th week after development of a heartbeat, the fetus may not proceed. When we do this test additionally for the men and we correct this DNA fragmentation index factor, the next pregnancy is a healthy one and goes on to full term.
That's amazing. Okay, now to the main topic, right? Just the top 5 things or 6 things, or however you think is important for the woman. What should she do after a miscarriage?
First and foremost, like I said, please don't approach it with guilt or with shame. You
Yes.
must know that more than half of the human population is going through it, right? It's literally 50% of pregnancies plus. So, number one, you're not alone. So, therefore, number two is a logical next step: get help, speak to a counselor, work with gentle things like homeopathy, batch flower remedies. These are things that we would do as part of every miscarriage history that has happened. You need to heal from this emotionally as well, right? And that is super important. Third, of course, follow all the instructions from your gynac. She has to make sure no remnants of the pregnancy are still there. So there's certain medications that are used. Sometimes there needs to be a procedure called a DNC that will remove whatever remnants are there. Once that is clear, give yourself at least 2 months to 3 months to conceive again. And in these 2 or 3 months, use it to really build up your foundations again. Whether it is egg quality or it is sperm quality for the man or overall the health for the lady itself, all of these can be worked on in 90 days. And once you do that, you should plan to conceive again. Again, it's at least all my senior OB-GYN teachers always used to say, if you have a miscarriage and it's a first miscarriage, many times it's the best window to conceive again within 3 months of that. Because the
Oh,
body remembers the last pregnancy. What you have to do is remove the trauma that is from the lost pregnancy. But the fact that a pregnancy happened means that in about 3 months' time, your body will be ready to conceive again. So you should be ready for that as well.
so for this is for anybody that you're saying that it within 3 months is a good time, or for certain women, maybe just waiting beyond 3 months would make more sense?
Sure. And it all depends upon how serious the condition is as to why the miscarriage happened, right? So let's understand that also a little bit better. If it's a first pregnancy and the couple just about trying and for whatever reason it did not happen, that's most likely the case where within 3 months they can try again. It's unlikely there were any big health problems. Egg quality was probably not good enough. Make sure you have all your vitamins, minerals, digestion, etc. in place. You should be ready. But if somebody is having a repeated miscarriage, if it's two or more, there could be things like immune factors in play.
Hmm.
That an embryo is 50% the mother's DNA and 50% the father's DNA. So once an embryo enters the womb, the lady's body actually has a dialogue with this embryo. The embryo presents credentials, literally, as if it's an ID card at the. It says, I am part you and I am part your husband. And, this is who I am. So please let me grow here. And the lady's body has to decide, okay, does this look like a real baby? Is it not a parasite? Because after all, 50% is not her. So this whole conversation takes place between the embryo and the womb. And if for any reason the lady has a heightened immune system, what does that mean? If she has any autoimmune conditions, body attacking its own organs is what is called autoimmune. So, for example, if it attacks its own thyroid gland, that is called Hashimoto's. So, if a body is already irritated and attacking its own organs, it may attack the embryo as well. So, in such a case, the immune system modulation is important before you conceive again. So, in such a case, you must not just get ready over 3 months, but do specific work to reduce any autoimmunity so that your body doesn't reject the next fetus. So, in general, if you're a young couple, otherwise healthy, first loss in a miscarriage, you should be ready in about 3 months' time of working on your foundations and making sure you're emotionally ready to conceive again. If it's a second miscarriage or more, you should carefully investigate what might be the reasons, eliminate those reasons, and then conceive. And that could be a slightly longer journey.
So, okay, fair. Now, some of the questions that I got asked from the women who are around me who've gone through miscarriage. One is, how soon can they start? Like, these are women who have been exercising and then conceived and then, had a miscarriage. Then how soon can they start movement? My answer to them always is, when you feel your body is ready, when you've healed physically, emotionally, mentally, and you have no pain at all of any type, is when you can really start moving slowly and getting back to exercise. But please correct me.
No, I think that's a very sound, commonsensical way of everybody to judge for themselves. What is important is start slow, right? So you should make sure that all the bleeding is over, there is no leftover remnants of the last pregnancy, and that you're not in any way feeling drained out or bearing down. The sensation of your pelvis dragging down shouldn't be there. And you start slow and build up as per your strength. That is perfectly valid advice.
So what happens? So there's one of them who has constant pelvic pain, right? Like literally every time she has her periods. And this is a 25-year-old girl I'm talking about who's had, first pregnancy or first miscarriage. And then now it's been about 4 months or 5 months, and she constantly has pain in her lower abdomen, pelvic area, and she's not able to get any solution from anybody, not her gynec or any other doctor. And it still remains a mystery, although she's just started some amount of movement so that, she can get some yoga or walking or exercise. But what do we do in such cases where people have lasting pain for like 4 months and 5 months?
Yeah, so this is quite unusual, and no doubt her gynec could have examined the the uterus carefully to make sure that all the remnants have been, taken out. They would have done a beta HCG test and made sure it's negative, so that there shouldn't be any fragments of the embryo still remaining. This is super important. Once this is done and there is an all clear, now we enter into the domain of the mind, the energy matrix of the body, and so on. This is where homeopathy truly shines. So if there are leftover pains, almost like we call it like a ghost limb, right? Somebody loses an arm in battle and they can still feel pain in the arm. This is called like a ghost limb. And there are ways to reset that pain. And there are similar things that one can do using homeopathy. So if this is one of those cases, I would do that. But first, I would make sure all the physical causes have been completely eliminated. So she should tell her gynec that she's still facing this pain. The gynec, if they need to do any additional tests, must do it. If it's all ruled out, then certainly we can help her with homeopathy.
Wow. Okay. And about nutrition, right? Is there anything that you would recommend for women who have just had a miscarriage, especially from supporting her hormones, right? Anything particular that you think there is a must to do post?
Sure. So we knew all these in our traditions, right? So the things that a lady would be given after a miscarriage, you begin with highly nutritive but easy to digest stuff. So it begins like a dal khichdi, right? So the khichdi with a lot of ghee for the vegetarians, a bone broth with again lots of ghee or butter for the non-vegetarians. These are easy to digest but nutritiously dense things. So you to build up the core energy, which in Chinese medicine is called the yin energy. And the closest we would come to in Ayurveda is prana. So you want to put back prana into the lady. So these foods which are easy to digest would be the first starting point. Raws should be avoided at this time. Raw foods,
Raw
salads,
food.
etc., should be avoided because they bring in more cold. Um,
Okay.
and therefore, even a salad should ideally be steamed or lightly sautéed rather than have it in a raw form. Slowly, you build it back because see, in one sense, it's no different from childbirth, right? So there is something that was there, and that thing is no longer there. We say there is empty space that is created, or vata or air element is high. So we need to ground that with nutritious foods. So again, we would, once the digestion is back to normal, start giving this lady same things that we would give a postpartum mother, like
Oh,
or methi laddu, or things which are nutritive in nature to rebuild her blood. That's literally what it says in the traditional wisdom. Rebuild the body because there is a life that has been lost. So you rebuild it all the way up.
okay. Wow, that's interesting because I don't think anybody knows about nutrition post a miscarriage, and everybody pretty much goes back to eating normal food, right? No one I'm not sure even if the gynacs are telling them that this is how you need to eat and this is why is it so hard for us to not educate our women?
See,
I
what has
mean,
happened is, there is a shift in medicine per se, right? Over the last 60, 70 years, the practice of the family physician has gone away, right? You no longer have family physicians. You end up at the closest large chain, big name hospital. You pick a number, you pay 800 bucks, 1,000 bucks, you see that person. It's not like that person knows you. That's number one. Number two, the earlier day doctors used to have nutrition as part of their medicine kit. They would advise you eat light, eat heavy, eat like this, eat like that. Those things have all gone in today's era of specialization, right? So you see a doctor, all you get from them is medicines. You don't really get any nutrition advice. They tell you you must eat healthy, avoid junk food, but that's the level of knowledge they have. With that, how do you expect them to give nutrition advice? So we need to revive our traditions. Unfortunately, in many urban families, it's been lost at least in one generation. Right? Our grandmothers themselves were educated and they have themselves also lost some of these little nuances that we had.
mm,
Mother is gone now. There's no hope in trying to, because there aren't that many children. Mother has had one child. What will mother know about miscarriage and this, that, and the other? So we have lost some amount of knowledge in the transition to modernity, and that's where that gap is. But luckily now you're now having doulas, natural birthing. There are gynacs who are part of such centers, so this knowledge is also coming back, but it's taking some time. So for your viewers, I would say start with nutritive, easy to digest foods like the soups, the broths, and the other things. Slowly increase as if you are given birth to a child. So you're literally adding nutrient dense foods like methi laddus or gond laddus or things like that, so that your blood gets built back. Green vegetables, colored vegetables, absolute no brainer. You must do it, especially if there is blood loss during the miscarriage.
got it. But we would do a cheat sheet for our viewers, listeners. We always put it in the description, and everyone who wants to follow a certain thing or probably share it with someone else normally download the cheat sheet and use it to their benefit. And of course, if they want more, then does Sipalika help with this as well? Like if they have to reach out to Sipalika
Sure, sure. So many women come to us after miscarriages, either natural or part of IUI or IVF. And, they're often confused. They don't know why it happened. The first thing they want to know is tell me why it happened. And the
Hmm.
truth is that there aren't clear answers.
Hmm.
However, when they hear the statistics itself, they heave a sigh of relief
Yeah.
because they began by thinking, I must be the freak. It's happened to me. What a terrible thing. I'm so healthy. I work out. I eat healthy. How can this happen to me? The truth is, the numbers are stacked against most of us. That is number one. Hearing that itself, that's the start of the program. They already feel better. Then, of course, we help them to rebuild the nutrition and we help them to get into the state where they're ovulating well
Yeah.
and, in fact, better than how they ovulated last time. Very, very important. We always work with the male partner. We say, bring us a sperm report with the DNA fragmentation. If you don't need any treatment, we are not here to just take your money or treat you for nothing. We'll tell you there's not needed and you continue doing what you need to do. But if it's right there and I'm treating the lady, what a waste of time, what a waste of resources. Unnecessarily, you've gone down the wrong path. So, all of this is part of a 3-month program. We help people rebuild themselves to have a healthier pregnancy next time. And most of them go on to a nice full term live birth, 38, 40 weeks, 2.5, 3 kg babies. That's how it.
Wow. That's amazing. Of course, your success rates are, yeah, high. Like, I don't know, maybe 100%, I'm guessing.
No, 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 not at all. We are as human and frail as every other practitioner. But the only thing is, because we try to cooperate with nature, I believe that our job is easier and nature also supports us, right? So
Yeah.
we don't try to force nature to, just give some ovulation medicines and for it to happen. We
Yeah.
align the person to nature. Nature wants nothing more than the next generation. So she cooperates.
Exactly. Exactly. The last question is there any difference, as in, okay, you've had IVF or IUI and you've had natural conception. Any numbers on miscarriage here? Like, we all know about natural conception and miscarriage. I mean, we've heard it from our grandparents' days. My grandmom tells me some stories as well about how many kids she lost. Out of them, 7 were, born healthy. So, but with IVF and IUI now, are there higher numbers? Just curious.
No, you've caught me off guard on this one, honestly. I don't know those numbers. But what
Yeah,
I know is when Stanford Medicine published its data,
yeah,
they took all cycles into account. So they
fair,
took natural IUI, IVF,
fair.
and while IVF does have a lower live birth success rate, means 1 in 3, it's not that natural has far greater either.
Yeah, yeah,
That is important because most people, it's not even recorded how many miscarriages truly happen. So
correct.
I would say, irrespective, wherever the miscarriage happens, the treatment method to get back to health is the same.
Fair, fair. Thank you so much, Dr. Mahesh. I think this episode is going to be very important for a lot of women who are, it could be who've dealt with miscarriage, or probably just people who have, conceived and just want to know this information at the back of their mind. And the cheat sheet will tremendously help. So we're going to request you to help us with the cheat sheet for everyone to download. And yes, for all our viewers and listeners, I hope this has really helped. And if it's helped you, please pass it on to, anyone, man, woman, anyone you think needs to know more about miscarriage, because this information in general is quite limited. Thank you, Dr. Mahesh, and thank you to Sapalika Fertility as well.
Thanks so much. We really admire all the work that you do. Thank you so much for educating people on such important matters.